Okay, picture this. Imagine the busiest, most important factory in the entire world. It runs 24/7, and every single day it pumps out billions of essential workers. Now, what if one day that factory just stopped? The production lines grind to a halt, the gates are locked, and suddenly the whole system is thrown into chaos. Well, that's exactly what we're talking about today, a condition called aplastic anemia. So let's get right into it. Aplastic anemia is a rare, but a very serious disorder where your body's main blood factory, your bone marrow, it just fails. It stops making the new blood cells that we all need to survive. And it's important to know, this isn't a cancer, it's a shutdown. So before we can really wrap our heads around the shutdown, we've got to appreciate what this factory does when it's running at full steam. Think of your bone marrow as having three main production lines, each making a different kind of worker. First up, you've got your red blood cells. These are the oxygen carriers, basically the delivery drivers bringing fuel to every single part of your body. When you're short on them, that's anemia. Then you have the white blood cells, the infection fighters. This is your personal security detail. A low count here is called leukopenia. And finally, you have the platelets, the clotting crew. They're the emergency repair team, rushing in to patch up any leaks. A shortage of these guys is called thrombocytopenia. But in aplastic anemia, something goes horribly wrong. The entire factory floor just goes silent. And here's the crucial part. It's not just one production line that fails. No, the result is a condition called pancytopenia. That means a shortage of all three types of blood cells. The oxygen carriers, the infection fighters, and the clotting crew. They all stop showing up for their shifts. And that is a full-blown crisis. So this obviously leads to the biggest question of all. Why? Why would this absolutely essential factory suddenly just shut down? And this is where things get really mysterious. Get this, in a full 50% of cases, the cause is idiopathic. You know what that is? It's pretty much the medical term for we have absolutely no idea. The shutdown just happens for no reason anyone can pinpoint. Now, for the other half, we do have a list of suspects, and the most common known culprit, it's an autoimmune attack. That's where the body's own immune system gets confused and actually attacks and destroys the stem cells in the marrow. Other triggers can be things like exposure to toxic chemicals like benzene, certain drugs, radiation, and even some viral infections like hepatitis or HIV. So when the factory stops producing all these workers, how does the body let you know it's in trouble? What are the signs of the crisis? And it all connects so clearly. Without the red blood cell oxygen carriers, you get those classic signs of anemia. You're just exhausted, you look pale, you feel short of breath. Without the white blood cell infection fighters, your defenses are down. You're getting frequent infections, high fevers. And without the platelet clotting crew, you'll notice you're bruising easily, or you get nosebleeds or bleeding gums that just don't want to stop. Every symptom is a direct result of a missing worker. Okay, so you've got all these signs pointing to a major problem. But how do doctors get the final proof? How do they confirm the factory isn't just having a slow day, but has actually closed up shop? To get the real answer, you have to go right to the source. A blood test can show you the worker shortage, but the ultimate proof? Well, that comes from looking at the factory floor itself, the bone marrow. And this is the gold standard finding they look for. When doctors do a bone marrow biopsy, instead of finding a busy, bustling factory, they find a dry tap. It's called hypocellular marrow because all that active blood-producing tissue has been replaced almost entirely by fat. The factory isn't just slow, it's empty. So, when you're faced with a totally empty factory, what can you do? How do you even begin to restart the system? Well, there are three main lines of attack. The first is basically a complete rebuild, a bone marrow transplant. You're bringing in a whole new factory from a healthy donor. The second is to play defense with immunosuppressive therapy. The goal there is to stop the body's immune system from attacking itself. And the third is all about support, blood transfusions. These act like bringing in temporary workers to keep things running and manage the immediate crisis. Now, while those big treatments are being planned or are underway, the day-to-day care is all about managing this triple threat of risks. You've got to prevent infection, prevent bleeding, and conserve energy. To prevent infection without that security force of white blood cells, the patient basically has to be shielded. That means a private room, obsessive hand washing, and avoiding anything that might carry bacteria, like raw fruits and veggies, or even fresh flowers. And a fever is no small thing here. It's a true medical emergency.
And to prevent bleeding when you don't have a clotting crew, every little thing is thought through. You use a super soft toothbrush, an electric razor instead of a blade. It's all about avoiding any chance of a cut or an injury that the body just can't repair on its own.
You know, when you really dig into it, aplastic anemia does a lot more than just explain a rare disease. It shines a massive spotlight on the incredible, silent, nonstop work that's happening inside our bodies every single second of every day. It reveals these hidden factories we all rely on, which kind of leads to a final thought, doesn't it? What other vital systems working tirelessly in the background do we all take for granted every single day?